Hi there, and welcome to the Physio Edge podcast. Great to have you with us here tonight for the Physio Edge podcast live. This is the podcast where we explore the latest evidence and the expertise of our guests and break it down so you get lots of practical ideas that you can use with your patients when you're treating musculoskeletal and sports injuries, and really make it practical for you. So tonight we're going to be focused all on running injuries, and we've taken a lot of great questions in regards to running related injuries and running assessment and treatment, and really looking forward to exploring all of this with our guest for tonight. And our guest for tonight is Tom Goom, and here he is here, as you can see. He's a physiotherapist that's based out of the UK. Has a lot of experience treating runners. He's got the website running-physio.com, and he presents courses, the running repairs course and the running repairs online course. So he's got a lot of experience, and we're going to be exploring all of his experience, his knowledge and expertise, and the research as well, to answer your questions on running related injuries tonight. So hi Tom, how are you?
Hi Dave, yeah, I'm good, thanks. How are you?
Yeah, great to have you joining us. And
yeah, thank you. It's a pleasure to be chatting again. I've enjoyed our podcast and stuff in the past. It's always good to talk about running and injury and get into it a little bit.
For sure, definitely. So welcome if you're joining us live on Facebook. You can put any of your questions, comments, all of that sort of thing on Facebook, and we'll be having a look at those as we go along, answering those at the end. And we've got a ton of great questions tonight, and we're going to be diving into them really shortly. And we're going to get through as many as possible. And if we don't manage to get through all your questions, then we'll come back next week and we'll be able to explore some more of your questions there. So down the bottom here, we've got a link as well to some great videos that are coming out really shortly, and they are on low back pain. They're presented by Tom Goom, and it's going to take you through the key elements to assessing your patients that have low back pain, and particularly your active patients. So you want to jump onto those 3 free videos. They're going to be available really soon, and you can get your access to those at clinicaledge.co/backpain. So that's the link for your back pain videos there. So jump on over, grab those at any time, and you'll get to see more of Tom Goom talking about low back pain, particularly in runners and athletes. So I think we might just dive into it. You got any?
Yeah.
How's things going
Good
over?
plan.
You're based out of Brighton there, Tom, in the UK. How's it all looking over there at the moment?
Yeah, it's good. It's good. A good week in clinic actually. Full clinic this week as ever. So it's good. It's always nice to kind of combine the clinic stuff and the research stuff together, because you see how it works in the real world, really. Because research is obviously very useful and a big part of what we do, but it's how we apply it that's important, I think.
Definitely. So, all right. Well, let's dive into it. So, first off, we've got some great questions here. Our first one, we're going to break it into sort of sections, and at first we're going to talk about assessing and treating runners. So, great one from Gordon. He said, "What do you think are the key concepts when you're assessing and treating running injuries?"
Oh yeah, that is a good question actually. I think. First of all, we want to try and approach running injuries very much from a person-centered kind of biopsychosocial approach. I don't know, that's very easy to say, but the more that we learn about running injuries, the more we realise how all these different factors are kind of interlinked with each other, down to the person and why they train the way they do, what they get out of running, as well as the kind of physical factors of strength, training load, etc. So ties that first and foremost, that it does need to be person-centered based on that individual, and it does need to take into account that whole kind of biopsychosocial approach, not just thinking it's running, therefore it's biomechanics, but thinking about the whole picture. So I think that's kind of the first key point. The other key concepts that we look at trying to do here is trying to assess the balance really between the loads that being placed on the tissues and their ability to cope with them. So within that, we would be looking at training load and other sports and daily activities that load the tissue, because that's really important. So a key concept really is to get a good history from the runner and find out what their training's like and how it's changed in the lead up to the injury, and what other sports they're doing, how they're loading the tissues. And then we want to see if we can assess their capacity to manage that load. And that's where we look at strength, control, flexibility, the right subjective questions in terms of what running they can tolerate, etc. And that allows us then to plan the rehab so we can achieve a balance between the training load and their ability to manage it. But as I said, we're doing that while kind of working within that person-centered framework. So we're not working with machines here. We've got to recognize the person, individual we're working with.
Definitely, yeah. And we're going to be exploring a lot more around that strength and conditioning side and the load management and all those sort of things there for sure. But that's a really nice sort of wrap up of some of the key concepts there. So beautiful. And now talk to us a little bit about gait retraining. So we've got a question in from Dave, and he said, how fatiguing is a gait retraining program on runners? Can you give us some tips on the best way to change technique? So let's start with the technique, and then we'll discuss the other parts.
Absolutely. I think when you're trying to change running gait, the things that you're trying to bear in mind is that you're looking at trying to reduce the load on painful tissues. So we're looking at what techniques will reduce load, and we're looking at their response then in terms of symptoms. Does it help their pain? But also in terms of comfort. So if you try a gait retraining cue and the runner says, it immediately feels like a lot more effort, then the chances are it's too big a change, and you'll need to try and help them make that cue a little bit more subtle. So to give you an example, one thing we use is we increase step rate, because we know that can change the load on the knee. So maybe we increase step rate by 10%, and that's quite a lot for some runners. So maybe during trying that cue, you can see they're getting short of breath. They tell you it's harder. So we say, okay, well, let's try something different. Let's try a 5% change to begin with. Let's kind of see if we can find that comfortable middle ground. If you want to be scientific about it, you can ask people to give an effort score for running at a set speed. So perhaps they're running at 10 kilometers per hour, and you say, okay, where does that sit out of 10? If 10 is maximal effort and 0 is no effort. And they give you a score, then you try the cue, and you say, okay, where would you score it now? Has it changed? And we don't want to see a significant change in effort with using the cue. Maybe popping up one effort point scores okay, but if it's significantly more challenging using a running gait cue, as I said, we'll try something a little bit easier, something a little bit more subtle, so it becomes a bit more manageable for them.
Great stuff. And is there anything you can do that, you said here, how fatiguing is it to actually change that? Do you think that it's a fatiguing thing when you introducing some new concepts, some new ways of running for your runners?
I think it can be challenging. Mentally, it's challenging, but that's why we often ask people to work with these cues for short periods, like typically about 20 to 30-second bursts. So that kind of reduces the effect of fatigue. We're not asking someone to go and do a 5K run and use the cue for the whole 5K run. It's just not really possible to do that. We're looking at 20 to 30-second bursts intermittently through a run, and in doing that, you'll often find and working to and not thinking about the cues as well. So that helps to reduce the fatigue. There have actually been some studies on this where they look at running economy, which is our efficiency, and see if it changes with running gait cues. And with small cues, like a small increase in step rate, it doesn't seem to change too much. So it's not likely we're going to be really making people less efficient, significantly less efficient with these small cues used intermittently.
Okay, great stuff. So they're mostly starting with small amounts, little bits at a time, just gradually building up their tolerance to it, rather than thinking that they've got to do their whole run doing that. They're just doing little bits at a time, so you avoid that fatigue element, and you're gradually introducing stuff for them.
Absolutely, and linking back to, I think it was Gordon's question on the key concepts for assessment and treatment. Think, where does gait retraining sit in that? Well, number one is, the key concept's getting the training load at the right level. Number two is probably getting the right recovery, the right sleep to manage that training load. Number three is probably looking at strength and conditioning. So your gait retraining stuff is usually down at number 4 or 5 on that list. So it isn't the biggest priority for most people, but it is a way that we can make some changes to the load on the tissues, which may help. So I think it's recognizing too where it sits in the bigger picture.
Good stuff. Now, the sound may be a little bit scratchy from your end, so we may try turning your video off for a little while and see if we can improve the sound there so that people can enjoy listening to it a little bit more. So do you want to try turning your sound off there? Sorry, not your sound, we need to hear your video off.
Yeah. Okay, yeah, so I'll try that.
Okay, now let's
try. Is that better?
Yeah, I think that is a bit better, actually. Yep.
Okay.
Yep, much better. Good. All right. So you get to see a little image of Tom. So that's something. So good. But all right. Now, so we'll move on to the next thing. So what about now? We've asked a question here from Jafar. What about cues to increase the leg stiffness while running to reduce injury risk? So I guess the first question is leg stiffness something that you'd normally be looking to achieve within your gait retraining, and use cues to do that?
It's quite hard to assess leg stiffness really within the clinic that we have. Within most people's clinic, it's difficult to assess it objectively. But you might see some runners, particularly runners with patellofemoral pain, who, when they land and they load the leg, when they get to that mid-stance part of running, where they're kind of transitioning from absorbing load to propulsion, they're in a very flexed position from the knee, quite dorsiflexed at the ankle. They're almost not quite stiff enough, and as a result, they're loading the knee in those deeper flexion positions, which has been found to increase patellofemoral load. So we would want them to flex the knee less at mid-stance, and in doing that would essentially be increasing the leg stiffness in those runners. And the only way that I'm aware of tested extensively to do this is increasing the step rate. So if you increase the step rate, it tends to reduce knee flexion at mid-stance and patellofemoral joint load and increase leg stiffness. So for those types of patients, it certainly can be a consideration, and I think it would be an increase in step rate that I would tend to go for as the main cue to do that.
Okay, great stuff. Does it reduce injury risk, you think?
It might do in those particular patients. There is some evidence linking stiffness with injury risk, but it's, as with most of these factors, there isn't lots of high quality evidence to show that it's a risk factor and that changing it reduces risk. So I think it's got to be individual specific and about a reasoning process. Can you reason through why that person, if they are spongier, if you like, they're not stiff enough, why might it put more load on the tissue that's perhaps painful? So, and if I increase the stiffness, will that help? Will that reduce the load? Does it change their symptoms? So I'd be more inclined to look at individual basis, reasoning it through, as opposed to sort of suggesting, yes, everybody needs to increase stiffness, because that's not likely to be the case.
Which brings up some interesting points, because a lot of people change their running technique or are looking for gait retraining because they feel like their current injury, or their current running pattern might be causing them some injury. So do you think, is there a role, if people are injury free, should they be looking to change their current running pattern, or is that just a pointless exercise?
I think for most people, if you're not in pain, I wouldn't tend to change their running gait pattern. And I would tend to use the other strategies to reduce injury risk first, because they're more likely to be successful and they're more evidence based. So primarily looking at how they're training and how that training is progressing, because sudden changes in training load are more likely to lead to injury risk. And looking at strength and conditioning, because improving a runner's strength is likely to improve their performance and may reduce injury risk as well. So get those priorities in there first, get them recovering well, planning enough sleep and recovery into their schedule. Then when you've got those things in place, then you might go on to look at something like running gait. But as I said, if they've not got pain, it becomes harder to justify changing it. Now, there is a little bit of evidence coming out now that might challenge that. There are a couple of papers that have found, one particularly Chanatal last year, that found that if they used a particular cue for people to run softly and quietly, it seemed to reduce running injury incidence by about 60% in that study. But that study is only one study, and we need more follow-up studies to prove it. And that starts to raise the question as to whether perhaps, if we've got more evidence there may be running gait changes that perhaps would reduce injury risk. And from a performance point of view, again, we've got evidence there associating certain running characteristics with better performance, like, for example, running slightly taller is associated with better performance. Not overstriding is associated with better performance. So it might be that if we can change those aspects of the running gait, we could improve performance, but no one's proved that yet by testing it. And I think that's the thing we've got to be a little bit wary of. Until there's decent quality evidence there, we want to focus on the things that are supported by research first, I would say, and be a little bit cautious about making changes when we don't know what the result is really.
Definitely. Okay, good stuff. Well, that's really good. And you covered there a little bit from our next question, which was from Danny, on what's the evidence for injury prevention. So you sort of talked there a little bit about the load management, only gradually increasing it, and what are some of the other factors, if you sum all that up, that are really key in injury prevention?
Yeah, I think arguably the load management side of it is key, and trying to make sure, if you keep it really simple, that training doesn't change too quickly. Because if we change training very rapidly, it often leads to irritation of the tissues and pain. The other things that I think we would look at would be the recovery side of things as well. So we need to have the recovery for our training. If our training increases, our recovery needs to increase too. So it's planning in recovery weeks into your schedule, planning in recovery days, and particularly making sure people get enough sleep, typically at least 7 to 9 hours a night. And that recovery should be for both the physical and the sort of psychological stresses we're under. And that's where we kind of see this link in with some of the psychosocial factors. Like stress can be a risk factor for injury. Perfectionism in athletes, because they tend to push themselves really hard and force themselves to train in a certain way, can be a risk factor for athletes. So this is where we see actually training at the right level, recovering at the right level, addressing stress and beliefs around training. Those things are going to be important in reducing injury risk. And if we combine those with some targeted strength and conditioning, that is a nice overall package then to hopefully balance the load on the tissues with their capacity to manage it, whilst working with that individual and their particular drivers.
Beautiful, because it can be hard to take rest weeks, especially if you're motivated. You just feel like you're slacking off and you just want to keep on pushing through. So sometimes, one of the keys for you is to make sure they're having rest days and also rest week periods as well scheduled into their program.
Absolutely, yeah. It's all about sort of part of the training planning, and again, it's a reasoning process, not a recipe. You look at your weekly schedule and think, when do I need my rest day? Is it a good idea to put a rest and recovery day perhaps after the longest run, so that you're nice and fresh and you can recover from that? Is it a good idea to perhaps put one before your fastest session, so that you're nice and fresh for your intervals? And sometimes this isn't really thought about. And actually, for one of the local clubs where we are in Brighton, they have their track session the day after the long runs. So instead of planning in recovery, then you've got your hardest, highest intensity session after your longest run. And that's not particularly helpful, because you're asking people to do the hardest work when their legs are fatigued from their longest session. So it's having that reasoning process in there and adapting the training to include recovery, before things start to get, too sore and tight and people have to stop.
Good stuff. And while we're talking about scheduling, and I think it'll be a nice segue into the next section talking about strengthening, how do you tend to incorporate strengthening into the schedule? Do you like to have strengthening on the same days as people are performing their runs? So for instance, if someone's doing like 3 or 4 days a week, do you like them to do their runs and they're doing a strengthening session? Do you like them to separate it later in the day and to do a strengthening session later and then have a complete day off? Or do you like to separate it so their legs are working a bit each day and do their strengthening on their off days, so their off days aren't really off days? Or what's your normal approach to that, Tom?
I think again, it's trying to sort of tweak it to the individual, because people train at such different levels. You will have some people who will be elite athletes training 10 plus sessions a week, so you have to plan it quite differently for those, and others that literally will be doing 2 or 3 runs a week maximum. So it's working around their training schedule and planning it in there with it. There's a few different ways that you can do it. For most of my runners, they're typically doing maybe 3 or 4 runs a week. So I will try and keep the run day and the strength and conditioning days separate wherever I can. So and maybe do a schedule that during the week you have your strength work and your run day separate, and then a rest day on maybe the Saturday before your long run on the Sunday, so you're fresh for your long run. You can modify that though. So say you've got an athlete who is doing lots and lots of sessions a week, you might have to combine your run on the same day. So typically what I would tend to get people to do is do the run first, and then allow at least 3 hours afterwards before doing their strength work, because we know that there's an interference effect. So you're not asking them to do the strength work and then run on very fatigued legs a couple of hours later. You do it the other way around. And it allows you then to do them on the same day and allow some recovery perhaps before the next run. If you've worked particularly hard with the strength training, you want to leave it at least 24 hours of recovery afterwards before doing a higher intensity run session. And these recommendations come from Rich Blagrove's recent 2018 review. So they're based on recent evidence in terms of integrating strength and conditioning into our running. So it's planning it in again. It's having that reasoning process. We work sometimes with sprinters, and often they'll have a high intensity day followed by a rest day. So they'll actually they'll put in their high intensity stuff and their strength stuff on the same day, and have a complete day off the next day and prefer to do it that way. So again, you can adapt it to the individual and have that reasoning process as to where we're going to put the strength stuff, how much recovery do you need, where are we going to plan the running in so that you're minimalizing fatigue and maximizing freshness for those more challenging sessions.
Beautiful. And it sounds like you're trying, if you've got those runners that are doing your 3 to 4 sessions a week and they're doing some strength and conditioning sessions during the week, that they're having a day off their legs. They're having a recovery day mixed in there as well, by the sounds of it too, ideally.
Absolutely. And, thinking about individuals, there are some people who will have never done strength and conditioning, and they might well actually get significant DOMs for 3 or 4 days afterwards. For those guys, you might have to plan it differently from someone who's done strength and conditioning for years and is totally used to it. And sometimes for people, particularly your high mileage runners that are training a lot, you have to periodize it. And by that I mean you plan it over a period of time. So where we are now at the moment, we're in September. A lot of my high-level athletes will be competing in half marathons and marathons in the springtime. So now they could be doing a strength block, focusing on doing maybe 3 or even 4 good strength and conditioning sessions a week and not running as much. And then as they build up towards Christmas, they'll want to build up their mileage. So perhaps they start reducing the strength sessions down to a couple of times a week as they build their mileage. And as they get up into peak training season, they might use a once a week maintenance session for their strength and conditioning. So when they don't have to train so much for the kind of endurance side, they can build up strength. And as they go towards race time, reducing the strength stuff down so that they can build up the endurance.
Beautiful. Okay, that's really nice. And that leads us on to our next section, which is we're going to be talking all about strength and conditioning. We've got a lot of great questions coming about that. But we've also been running the 7-day challenge over we're up to day 6 now, which is fantastic. And we've got the Clinical Edge Facebook group going, and everyone's exploring back pain exercise. So exercises we're using around a theme for the day, and it's been fantastic. Everyone's been getting in the Clinical Edge Facebook group, sharing a ton of great exercises in there that you're using for treating back pain and for different aspects. So some of it's around movement control, some around range of movement, some around strength, neurodynamics. There's been a lot of great stuff. So that's been fantastic to see all that strength and conditioning stuff that people have been sharing there. And I think that's going to, if people are interested, you can jump into the Clinical Edge Facebook group. That's at facebook.com/Clinical Edge, and you've been sharing some great stuff in there too, Tom. It's been awesome. So we're going to dive into.
Thank you. Yeah, it's been good, isn't it?
It has.
Yeah, it's been good. I've enjoyed it.
Lots of great
it's been some really good stuff.
Lots of videos from people just sharing what they use for different aspects of back pain. It's been great.
Yeah, and it's nice we have people from all over the world, and that's really lovely to, have people contributing from, literally all over the world, from the UK, Australia, America, India. It's been fantastic for that, which is really, it's nice to bring a community together and talk about, how can we make things better for our patients.
Yeah, for sure. So that's been awesome. Now we're going to be talking a little bit about strengthening and conditioning now for a little while. So first off, we've got a question in here from Ruth saying, what strengthening exercises do you give to your runners, and how do you make them functional?
The functional question. You have to put the little speech marks either side of functional, Dave. So because it's one of those. That's it. Yeah. I can't do that. I'm doing the my end too, honest. Yeah. I mean, that's a really good question, and again, there aren't recipes here for this, but I think the first thing is to think about what are the needs of that individual. What do they need? And hopefully with the right assessment, you can identify their needs in terms of where it needs to be strengthened up and reason through why that's important to them for their pain or their performance or for the load upon the tissue. So that's important to have that process and individualize it. With runners, we often will end up strengthening the big muscles that have important roles in running. So typically we will look at the quads, the calf muscles, the glutes, and the hamstring, because those muscle groups, they have important roles and they often do benefit from being strengthened. But we will look at other muscles as well. The adductors, the hip adductors, can be important, and actually they assist the hamstring in their function. So I would commonly look at the adductors if someone has a hamstring injury. When you're looking at foot problems like plantar fasciopathy, there's evidence of weakness in the things like the ankle everters. So I probably would have a look at strength generally around the foot and ankle. In older athletes, sometimes we see that more mature athletes, the calf is an area where they tend to lose strength. So I might prioritize looking at that. So it's about sort of addressing the needs of the athlete and thinking about what you need to add in and thinking about the key muscle groups. In terms of how do you make them functional, now I think the important thing with this is that we're wanting to replicate the function that the muscle does during running, and it's working essentially a little bit like a very complex spring. And in order to achieve force, it needs to be able to produce that force quickly enough, and it needs to be stiff enough. So a functional exercise for that is something that prepares it to behave like that complex spring. And the key point to take from that is that the exercise does not have to look like running in order to do that. So I would be very, I try and avoid now saying, okay, well, we can't do, say, side-lying leg lifts for the glutes because they don't look like running, therefore they're not functional. We can't do Nordics because they don't look like running because they're not functional. Those exercises can still be functional because sideline leg lift strengthens up the glutes for it to be able to produce enough force to manage with running. The Nordics are functional because they work the hamstrings in an eccentric manner, which is thought to be similar to how they work during running, which makes them functional. So I think we can think outside the box a little bit in terms of functional exercises and consider it in a slightly different way, and that opens up our exercise options, which can only be a good thing.
Great stuff. So you're thinking more along the lines of preparing their muscles for some of the activities that they're going to do, rather than thinking that everything's got to look like a running movement, and that's what constitutes a functional movement.
Absolutely. I mean, one of the key examples we see from this is running man. People love the running man exercise where you're balancing on one leg and you're moving the arms and legs as if you're running. Now, it looks a bit like running, but it's at such a low level in terms of strength, it's very unlikely to create much strength change. It might help with movement control, but it's not really likely to get people stronger. So is it really preparing them for function? It looks a bit like the movement, but is it really that functional? I would say from a strength point of view, probably not. So it's worth bearing that in mind. It isn't just about recreating the movement pattern.
Definitely. Maybe functional for the dance floor.
You've seen me dancing, Dave.
somewhat, Tom. But you're quite a good dancer, actually, if I might say so.
I don't know. I learnt from my dad.
Yep, I can imagine. So, all right, moving on. So we're talking about glutes here. So we've got lots of questions about glutes. What's your thoughts on underactive glutes or poor firing glutes? Is there such a thing, and does it contribute to running injuries?
I think underactive or poor firing glutes, it's a term that's used, really almost quite flippantly, to be honest, and without really much evidence to support that it's an issue or that it exists. And what I find, people say they'll look at a person moving or running and saying, "Oh, that person's glutes are not firing." Well, you really cannot tell that from looking at someone. You can't, and if you look at, say, an EMG study, which will tell you when the muscles activate, the changes are incredibly small in terms of timing, milliseconds. You're not going to see it just by looking at someone or really just by palpating the muscle during activity. So I would say weak glutes may well be a contributor to some running injuries. So where the glute isn't perhaps strong enough to produce enough muscle force, but I think the evidence is quite mixed in terms of activation of glutes and firing of glutes, and I would probably tend to focus more on the strength side of things, more on the movement control side of things in terms of getting the glutes to control the pelvic position and position of the femur, rather than spending too long on the kind of firing activation side of things.
Okay, so if you're looking at your runner and, for instance, they've got a bit of contralateral pelvic drop, then what sort of information does that tell you, or what do you do about that?
Yeah, good question. Well, first thing to recognise with that is that movement pattern may not be related to your weakness. It may be simply the movement pattern they have, and in fact the evidence tells us that you could take that runner off and strengthen their glutes up a lot, and it won't necessarily change that movement pattern. So it probably isn't necessarily purely down to firing or activation of the glutes. It may be related to strength, it may not, but if you want to change that movement pattern, you need to get them to practice moving in a different way. And typically contralateral pelvic drop in runners is linked to hip position during the loading phase of the running gait. So typically a runner may be quite narrow, and during that loading phase they're quite adducted from the hip, and that's often accompanied by that contralateral pelvic drop. So with them we might use a cue to get them to run slightly wider. So you could cue something like run wider, run either side of a line, or one of my favorites, don't let the knees touch, to get them to open up and reduce that hip adduction a bit, and that will often reduce contralateral pelvic drop, rather than just saying, right, let's get you really strong there, because actually from several studies it would suggest that probably won't change it a great deal.
Mm-hmm. So it can be not just a matter of strengthening or firing or whatever. It can be that movement pattern needs retraining as well to make sure that they are actually getting a decent at that. Not so they're avoiding a pelvic drop in this example here.
Absolutely, yeah. So that's one of the things we find with movement patterns and movement habits, is that they're quite specific to the activity that we're doing. So if you want to change someone's running pattern, you have to practice their running pattern. It doesn't seem to change by looking at other exercises and assume that they will carry over into it. Most of the research says you actually have to practice cues and things during running if you want to change that running pattern.
Yeah. Okay. So would you generally, in this, like if you saw that, would you test glute strength first off to see if that could be part of the issue contributing problem?
I would test glute strength. Again, it would depend on the patient and their presentation. But as I say, glute strength may be part of the picture, but just simply strengthening the glutes wouldn't be enough on its own. You might find in order to help them make the change you want in running, that being stronger through the glutes helps, particularly if they're especially weak. But just strengthening the glutes probably won't be the solution, really. And I think the thing is, like we said right at the start of this, running injuries, they tend to be multifactorial. They tend to be this interaction between biopsychosocial factors. So it really comes down to one thing, like all your pain is because you have contralateral pelvic drop or because you have a weak glute. There's nearly always a bigger picture in which we need to see this and address the bigger picture rather than getting too bogged down in one particular factor.
Yep, excellent. And I don't want to bang on about glutes too much, but there's lots of questions about it. And I think it's a commonly, possibly overdiet. Well, there's a lot of focus commonly on the glutes, so it's good to explore this a little bit more. And often things all get put down to the glutes, and they need to fire their glutes more, or they need to. People are giving potentially exercises for their glutes before they run to make sure the glutes are firing. Is that something that you would be interested in doing with your patients if you're going, you need to do these glute exercises before you run? Is that something you ever do?
Occasionally, I think with that, what I'm looking at doing then is more thinking, does it actually change their symptoms? Does it increase the amount of time that they can run for before pain comes on? Does it actually change anything? And I think this is something to recognize, because studies are very difficult in terms of showing individual response to things. So sometimes I think it's quite reasonable to have a theory and to test it with an individual and to see. So, there is some evidence, Fisher et al. In 2016, looking at gluteal activation exercises, that it can increase gluteal activation in terms of within the brain, that balance between cortical inhibition and excitation that we need with muscle work. So they looked at doing long hold gluteal exercises of about a minute and repeating them 20 times. So you're looking at quite a lot of reps, really. So, but that did seem to increase the activation. So you could say, okay, well, let's see. I mean, maybe not do 20 minutes pre-run because you'll never get time to run, but let's try this pre-run. Let's try a few of these pre-runs, some long static holds, and then you tell me what it does to your hip pain or your knee pain, or let's try and see if it actually does change your running gait pattern if we do, before and after testing with our gait analysis. Let's see if it makes a difference. But again, it's not likely to be a priority. We wouldn't want to be spending sessions and sessions focusing on this and not looking at the training load or not discussing recovery or not actually getting them stronger. So it's probably a 1 or 2%er, something you might add into a program that's already quite established rather than something you'd base a program on.
Good stuff. Okay, I think that's great. There was another little bit about glutes as well, and now commonly the reason I'm still going on about glutes is that commonly people get they might come in with Achilles tendinopathy or something like that, and they're given a glutes program. What's your thoughts on going, okay, you've got an Achilles tendinopathy, we just need to strengthen up your glutes so that your Achilles doesn't have as much load on it? What's your sort of thoughts there?
Well, there is some evidence that people with Achilles tendinopathy can be as much as 30% weaker at the hip. So you could justify strengthening up the glutes in someone with Achilles tendinopathy, but we have to remember that hasn't really, as far as I know, been tested to see if it changes pain. So what I would say is we need to be aware of our priorities. So if you've got Achilles tendinopathy, most of the evidence would suggest our priority is strengthening the calf complex and the Achilles. So by all means, add some gluteal strengthening to that. I think that's quite reasonable if they are weak on their painful side, but we need to make sure we've got that strengthening work around the calf and the Achilles in there as a priority. And I think we've got to be a little bit wary of blaming one thing for everything. If every patient that comes through your door you're saying you've got weak glutes, that's the cause of all your problems, you need to start to wonder if perhaps we need different assessments in there. We need to sort of broaden our horizons a bit. So you think about which muscles do which roles in running. The glutes do work quite hard. The peak load on the gluteal muscles is roughly around about 4 times body weight during running. But the quads muscles probably work a little bit harder, maybe 4 to 6 times body weight. And the calf muscles are harder than that, 6 to 8 times body weight. So, actually it isn't necessarily the muscle that does the most work. There are other muscle groups that also need to work together. So I would encourage people not to get too bogged down in the glutes and think about the needs of the individual and whether it actually is a factor for them.
Great stuff. So, and you, like you say, you're addressing that local pathology, you're addressing if they do have a weakness there, but you're also incorporating all those other elements around it to make sure that they require it and that it changes their symptoms, and that there's a lot. You're addressing the holistic, their load management, their rest, and all those sort of factors as well.
Absolutely, yeah. I mean, you're underpinning it with a reasoning process that says this is why this is important to this person.
Yeah, for sure. Okay, good stuff. Now, let's talk a little bit about on the strength and conditioning bandwagon. So, calf strength. So, we've got a question from Matt saying, with testing strength, hundreds testing is a good way to do this. Now, when you're testing for the calf, do you ever use hundreds testing for calves?
Yeah, I think the term the hundreds test, I think, if I'm right in understanding, Matt, there is one of the things that we've found through looking at the research is that we do these reps to fatigue tests. And looking for the research, there's these rough ideas of how many reps we should be able to do to fatigue of various different exercises. So, for example, for a calf raise, we're looking at about 25 reps to fatigue. Similar for a single leg bridge, roughly 25 reps to fatigue for a single leg rise test, which is essentially a single leg sit to stand. And again, similarly, roughly 25 reps to fatigue for side lying abduction. And these are just all ballpark figures. They're not been tested extensively in runners, so we've got to be careful with that. But that adds up to 100. So you could see how many, can you get to 100 on each leg? Can you do 25 calf raises, 25 bridges, 25 side lying abductions, and 25 single leg rise tests? And that's your 100 test, if you like. If you're scoring 100 on both legs, that's pretty good. But I would urge a lot of caution with that, and saying that we have to apply this to every runner, and that it is truly evidence-based, because they really are just ballpark figures. Some runners will get nowhere near that and still be running very, very happily. Other runners, particularly elite levels and sprinters, will be able to do that without breaking a sweat, and you'll need to challenge them and load them heavier to find their deficits. So I would tend to do that, look at 10 rep max or 6 rep max or above, because you probably won't find differences with the lower load test like this.
For sure. Excellent. Okay. Now, moving along with calf injuries still, we've got another question here from Lynn talking about what's the key to rehabbing calf strains?
Ooh, good question. So if we're looking at an acute calf strain, your typical sort of sudden onset, feels like they've been kicked in the leg, maybe a fair amount of swelling and pain afterwards. With those, it is going to depend quite significantly on the severity of that injury. Some people will have a low-grade calf injury and actually be relatively comfortable quite quickly. We had one gentleman a year or two ago who had a probably grade 1 calf strain and actually managed to run a marathon a week later. So wouldn't advocate that for most people, but he'd been training for 6 months to do it. So it was kind of come hell or high water, he was going to do that marathon. And then you'll have other people with a more severe calf injury that will come in on crutches and struggling to weight bear. So it does depend on the nature of the injury, the severity of it. But what I would tend to want to do is try and restore dorsiflexion range. That's important to make sure that they've got similar range left and right, and then to try and restore the calf strength. I think Matt asked in his question earlier, is it important to test soleus or gastroc with this? Well, I would say do both, particularly in a calf injury. So you could do your reps to fatigue with a straight leg and then repeat it with a bent leg later on in the assessment to see if you can bias more soleus. Or if they're very acute and irritable, they may not manage that yet. You may just be looking at starting with 2-leg work. But the progression then would be to find a start point that they can manage, maybe some 2-leg calf work or some calf strengthening in the pool, so some of their body weight's offloaded. If they're very, very weak or very painful, we might even start with TheraBand work, or using the leg press is a quite good way of introducing calf work if people can't do body weight. And then we want to progress that through into single leg work, single leg calf raises on the edge of the step, for example, so you're working them through range. And when they restore their strength and their range of movement, then I would look at bringing in power work, because the calf needs to be powerful and needs to be able to produce force quickly. So then you might be leaning towards more plyometric exercises, etc., to really challenge the calf and build up its power towards the end stage of the rehab.
Okay, so you're not just looking at your heavy, slow loading in this case. You're starting that, you're building up their strength, and then you're incorporating that power, the plyometric, and the explosiveness in the calf as well.
Absolutely, and of course, as with all of these things, it really depends on where that individual wants to be. If that calf strain is in an elite sprinter who is going to be exposing their calf to high levels of force and needs to produce that force very quickly, we need to rehab them to cope with it. If you're looking at someone who actually isn't a runner, perhaps is just done it moving awkwardly or something, they're not keen to get back to sport, then the demands on that muscle are going to be less, and the rehab needs are probably likely to be less as well.
Good stuff. Alrighty, now we've got a question here from Margot saying that I've got short hamstrings and thinking it's protecting the sciatic nerve. And I don't think she says, I don't think stretches even with a bent knee. So getting the hamstring, not the nerve, are the answer at all. What are the best ways to improve hamstring length?
Yeah, I think stretches, they often don't really have much of a long-term effect. They perhaps have quite short-term effect, purely muscle stretches. So if you wanted to improve the hamstring length, I would work it by strengthening it in positions where it is under tension, where it is under stretch. So you could be looking at exercises like straight leg deadlifts, trying to work into range so that you're actually strengthening the hamstring in that lengthened position. Exercises with an eccentric bias have been found to increase muscle length too. So that might include things like your Nordic curls, things like the supine leg curl, rolling out the skateboard and things, because they're thought to increase fascicle length. So I probably would bias it towards that, working the muscle in lengthened positions, working the muscle eccentrically, and use that to build length over a period of time rather than just stretch. But I think if you suspect sciatic nerve symptoms, I would also think, is there something else driving this? Are there any issues around the back? Is the sciatic nerve irritated? And just make sure that if there are any issues there around neural mobility or issues around the back, that they're addressed. Because if they're the driver for it, you might actually find some of these exercises are a bit uncomfortable.
Yeah, for sure. Good stuff. And she's mentioned there just bending the knee as well for taking the hamstring, taking the sciatic nerve off stretch, but you're also looking at your dorsiflexion component as well. So if you're thinking the sciatic nerve, then taking out that dorsiflexion will change the tension there. So and there's some evidence comparing the just stretches with some neural glides and stretches, showing that you can get some improvements with if you incorporate neural glides. So if you're suspecting that's Tom, what you've described there is a really nice way of looking at it, thinking about from that lumbar spine, and then looking at possibly incorporating the neurodynamics element to it as well. So as well as you're strengthening to improve the length of those hamstrings.
Absolutely, yeah.
Beautiful. Okay, and just on the calf thing, there's a really related question come in on Facebook that said, from Maria, saying, are there any key factors that you'd look, we'll just put up here, key factors you look at in rehab of a plantaris tear that differs from your usual calf strain?
Oh, good question. I must admit that's not something that I've really come across greatly, plantaris tear. So as far as I'm concerned, I think, from my point of view, you probably look at working with what other restrictions, where are they weak, where's their loss of range of movement, where needs to be strengthened up, and you probably would need to strengthen through the calf. But I'm not aware of any other specifics that you would add to that personally. Anything you've come across, Dave, from plantaris tears?
Probably just because it's such a small muscle, to rehab it a little bit more slowly and conservatively than you might with your regular calf tears sort of thing. So it's probably likely to have a bit of a slower time frame, would be from my experience with these things.
Yeah.
Put you on the spot.
I would agree. Yeah.
Good one.
Yeah.
All right. Good question there, Maria. Thanks. And now moving back to the other questions we've got in before. This is also about the stiffness. So I feel like a lot of runners have stiff hips and struggle to stabilize through their core through running. Now let's talk about the stiff hips bit, and that's coming from Danny. So what's your thoughts on that? On runners, do they normally have stiff hips, Tom?
Yeah, I think you do see that particularly in older male runners. They lose a bit of hip extension sometimes as they get a little bit older, and I think then it's about, again, reasoning through, why is this relevant to them? Why is it important? Does an example of where it might be is low back pain. If we lose hip extension, that can influence the low back. So that would be an area where I would look to try and restore, hip extension, range of movement. So I think it can be a factor, perhaps, with lower back issues, perhaps with issues around the hips and pelvis themselves. But again, it's reasoning through and saying, why is it particularly important for this person, and will changing it actually help them? Another area with the stiffness around the hips is thinking, where does it come from? Is it from the joint, or is it actually due to muscle tightness around the hips? And there is some evidence, if you're very tight in your hip flexors, for example, that it actually increases stress on the hamstring. So that might be a factor in hamstring injury. The other part of the question about sort of stabilizing dynamically through the core, I think with core it's a difficult one because it's so poorly defined. It's very difficult to define, it's quite difficult to measure, and as such there isn't a great deal of evidence in running that core focused exercises, your perhaps traditional core stuff, your transab stuff, is especially effective in either treating injuries or preventing them. So I think with the core, probably we need to get a better definition of what it actually is before we can really understand its true role.
Good stuff. Okay. And then there's a question coming in from Helen. She said, how can you help a runner with a medial meniscal tear in their knee without surgical intervention? It's a 52-year-old runner with intermittent pain on weight bearing, occasionally climbing stairs, but can still run up to 10 minutes without aggravating his symptoms. She doesn't really say what happens after 10 minutes, but he's tried resting and progressed to cycling before running, but doesn't seem to be improving after 8 months. He wants to return to running.
Okay, yeah, these ones, Helen, are not necessarily that easy to manage, and they don't necessarily improve very quickly, I would say, in my experience, because I have a few runners that I would say are similar presentations to this. A few things to bear in mind is that meniscal tears are common and they can be asymptomatic. So we want to be a little bit careful just assuming that this is, that means he can't run or that it's going to cause him problems. I would also tend to use the swelling response and pain as a bit of a guide. So what I'd be looking to do is try and build up running without seeing an increase in swelling and pain that lasts afterwards. Because for me, with any intra-articular injury, swelling is often a sign that we're aggravating things. So I would use that as a bit of a guide. If he's managing to do 10 minutes, that's a good sign, because sometimes the hardest things with these patients is getting them to a point where they can tolerate impact. So what I would probably do is focus on trying and getting them as strong as you can through the limb to manage the load. So particularly through the quads, the calf, the hamstrings and the glutes. Build up that strength as much as possible to see if that can be a way of perhaps reducing some of the stress on the knee. Also with knee pains like this, weight can be a factor, and of course I can't comment on this particular person, but if they are overweight, then reducing weight can help on the knee. And then I would look to see if you can gradually build up that running. If the strength's there, can you get from 10 minutes to 12 and on to 15, etc., gradually building up that running and seeing if there's a response from the knee in terms of swelling. The other thing to think about with this is an increase in step rate can reduce the load on the knee joint, so it may be an option to consider with him, especially if he's overstriding and has got a low step rate to start with. So I'd probably use that combination: strength work, building up the running gradually, maybe having a look at some gait re-education and being guided by how he responds, how his knee responds to what you're doing.
Great stuff. So what are some of the things that she'd look out for if she's trying to she's trying to identify if it is actually a meniscus that's contributing to this patient's pain, or if she was thinking about differentially diagnosing from something else? So you mentioned there the swelling. So you'd be thinking there'd probably be a swelling response with some sort of meniscal injury after.
I think I would see swelling as a sign of an intra-articular injury. I would see medial joint line pain, perhaps pain on palpation around that area, possibly restriction in range of movement. So towards end of range flexion or end of range extension being painful or restricted. And then the rest of the history, what is this gentleman's history? Is it traumatic history? Is it completely atraumatic? What are the other tests like? You might expect MCL test, etc., to be negative in this case. And I think even with the medial meniscus, perhaps you thinking that is a part of the symptoms here. I think the point I'm making with saying that people can have it without pain is just to saying that it doesn't mean that this person can't run or that they necessarily will always have pain. It may be a part of the factors that are contributing to it, but sometimes people are given quite a bleak message. In fact, I had a patient just yesterday who was told by a consultant, did their MRI and said, right, you need to stop running now. Don't run. And actually, that we shouldn't be telling people that based on purely on an MRI. Really, it's got to be based on, can they manage running? Do they want to run? Are they able to build up and manage the symptoms?
Great stuff. Okay, that's awesome advice. So I think we'll move on to a question from James, and this might be we might take a couple of the questions from the chat room, but this will be one of our final questions from the submitted ones. So James has asked, what role, if any, do you think femoral/tibial rotation has on ITB insertion area pain in runners?
There is a theory that it can, it can place more stress on the ITB insertion if you've got excessive rotation. What I think with this, it's difficult to determine directly through the assessment, and sometimes it's difficult to change because that may be part of their structural makeup. Some people are naturally a little bit more externally rotated through the tibia, for example. So if we can't change it, we have to ask ourselves whether it's something we need to get too bogged down in. What I think you maybe could do is see if you try and change their movement pattern a bit during running or during aggravating factors, does it help? If you, for example, ask them to reduce some of that tibial external rotation by pointing the toes like further forward as opposed to out to the side, what does it do to their symptoms? But if there's a structural issue there, if they have that tibial external rotation structurally, what you'll find is when they try and do that, it'll just move the hip into a more uncomfortable position. So you might find it's not necessarily that changeable anyway. So I think that's how I would approach it. I personally, with ITB, tend to focus on gluteal strength, more on single leg loading control, more on load management, and looking at things like stride width during running that are a bit easier to manipulate. And most people, once the ITB is calmed down, they do actually seem to respond quite well to that.
Great stuff. Okay, and you've really answered his questions. How do you assess and treat this ITB, insertional area pain? So you mentioned there about your treatment phase. Anything else you normally incorporate into your assessment to help you potentially identify, diagnose it, that sort of thing?
Yeah, again, I would look to see, why is the ITB perhaps being loaded more? Is it due to gluteal weakness? Is it quads weakness? Is it the movement pattern? And then that allows you to try and reason through and address those causes. It may simply be a load issue. This person has suddenly increased their mileage, and now they've got a slightly sore ITB. Is it more about load management than anything else? So a good assessment helps you to plan the right treatment.
Fantastic. Okay. Well, I think there's a couple of questions that we'll answer from the chat room there. It's a really nice one from Adrian, and he said, my university, he's a physio student in the UK, they're currently doing a lot of research into barefoot running. Are there any injuries more prevalent in the barefoot running population, like Achilles? So any downsides to barefoot running?
Yes. There are. I mean, the problem is that when you shift to a barefoot running style, is it does tend to increase the stress on the foot, the calf, the Achilles, and the ankle. So when you look at studies of people that have tried to transition to barefoot running, this is when where you tend to see injuries develop. So things like metatarsal stress fractures are relatively common, calf pain is common, Achilles pain is common as well. So that would be potentially the downside. The upside, if you like, is that if you switch to barefoot running, and as part of that, if you're moving towards a more forefoot style, you're likely to reduce the stress on the knee. So in theory, it could be helpful from that point of view. But actually, in reality, some of the studies where people have transitioned towards a more minimalist shoe or more barefoot style have actually reported increases in knee pain. So I think with this, again, it's about being a little bit sort of objective and systematic in our thinking, asking ourselves, what do we actually want to achieve? What's our starting point? What do we want to achieve with this? And is there evidence that making a change to barefoot will achieve that? So if it is to improve performance, is there evidence that switching to barefoot will change that? Well, the evidence isn't particularly compelling. Yes, you lose the weight of the shoe, which can help, but you lose the cushioning properties of the shoe, which might mean more muscle work. So it's not very conclusive that switching to barefoot is going to make you perform better. Is it likely to reduce the risk? Well, probably not, because you tend to get injuries in other areas like the calf, Achilles, and foot rather than the knee. Will it address this person's pain? Well, there aren't many studies that have looked at that. So it's difficult for most people to really justify switching to barefoot when you look at it in that way. But if there is a reasoning process and you can justify it from an individual point of view, then it needs to be done very gradually, because that's the way that you do it to reduce the negative outcomes from it.
Good advice there. Had a few patients that have switched over to barefoot running and done a bunch of Ks and ended up with a number of bone stress injuries in their feet. So that can be a bit of a downside. If they, like anything, you just start changing. And like you mentioned before, if you change things too quick, then you can end up with all other issues. So you had some great advice earlier. Gradually introduce changes, and rather than all at once. So that sounds like it applies to this as well, Tom.
Absolutely. And I think I must say, there's a couple of points as well, is that sometimes when we say this, it comes across that we're anti-barefoot. I'm not. I'm just anti-big change when there's not necessarily a reason to do it. So if you're working with someone who has always run barefoot, I would have exactly the same thought processes if somebody said, let's put them in a running shoe. I'd be thinking, is it going to improve their performance? Is it going to reduce their injury risk? Is it going to help their pain? And if there wasn't compelling evidence that it would, I would feel exactly the same about that. Why would I want to change their loading habits quite drastically by putting them in a very supportive shoe, for example, if there's no evidence of benefits? And it's interesting with the running shoe community, they do tend to sort of jump on trends quite a bit. We've just had a guy who ran, I think it was 300 meters, 3,000 meters and finished first with one shoe on. I don't know if any of you guys saw that. He lost his shoe early on in the race, and it wouldn't surprise me to see a sudden one shoe trend appear off the back of this, because it does seem that these trends they come up. They're not necessarily based on science and things. They're often people sort of defend them almost quite emotionally, when we really need to be thinking about whether they suit the individual.
So I'm really keen to see a lot of these people with one shoe on. So that'll be
the new trend, one shoe wonders.
New trend. And I think the final question that we'll finish with, and I think because it leads on nicely from this, and we touched on it at the start of the podcast, but I think that it's a nice place to wrap up, was from Carolyn, which she said, if someone's asymptomatic, would you still try and change their movement pattern?
Probably not. I think that links back into the kind of running gait questions earlier on. I would say generally not. No, if they've not got any pain, it becomes much harder to justify trying to change their running gait pattern. And as we said earlier, what are their goals from this? If it's about performance, there are certainly other things I'd look at as a priority. Same would be true if it's about reducing injury risk. So I think address the priorities first: the training load, the recovery, the psychosocial stuff, the strength stuff, and then maybe you might think about changing the pattern. But for most people, it's not really necessary, and it's quite hard to justify a change if they've got no pain.
Excellent. And I think that's a great place to wrap it up for this week. We've covered lots of great stuff on your load management, about your gait retraining, scheduling your weeks, injury prevention. They're not a lot about strength and conditioning, so that's been really fun. And what I think we might do, because we've got a lot more great questions come in, looking at tendinopathy, more on footwear. So and there's a lot of great stuff. And Melanie said she's off to go running in one shoe now. So there's lots of great questions come in. And I think what we'll do is we'll come back next week and we can have a chat more about some of these other great questions that have come in. So we'll schedule that. We'll put it up on the Facebook page. Most likely to be about the same time next week, but we'll confirm that on the Clinical Edge Facebook page. So thanks, Tom. There's been a ton of great info in there. Thanks for coming on the Physio Edge podcast and sharing all that information with us on running injuries, answering so many great questions. So that's been fantastic.
Thank you very much, Dave. I've really enjoyed it, actually. It's been nice. So I look forward to next week having some more discussions and things, and answering some more questions.
Definitely. So that's been great. Now remember, you can go and grab your access to the 3 videos that Tom's presented on low back pain assessment. That's over at clinicaledge.co/backpain. So go and grab your access to those 3 free videos. They're going to be out really shortly, and it'll take you through that step-by-step approach to assessing your patient's low back pain. So lots of great stuff in there. And thanks for joining us. If you've joined us live on Facebook, or if you're listening to the recording, I hope you've enjoyed this podcast. There's been a ton of great stuff, and I'm looking forward to our next episode, where we're going to be exploring a lot more running related questions. So thanks everybody, and thanks Tom.
Thanks Dave. Look forward to seeing everyone next week.
For sure. Now tell people, where can people find out more about yourself and what you got going on?
Well, you can find me on my website, which is running-physio.com. Also on Twitter, which is at Tom Goom. Come and say hello. Yeah, I look forward to chatting to everyone.
Thanks, great stuff. So on Twitter, and then also at running-physio.com. And Tom's been sharing lots of great videos in the Clinical Edge Facebook group as well. So that's over at facebook.com/Clinical Edge. You'll find the link to our Facebook group there, or just search Clinical Edge and that group will come up. So jump on in there, see all the great strength and conditioning stuff and back pain treatment exercises that have been going on in there. That's really great. So thanks for all your input there too, Tom. So everyone have a great night and or great day, whatever it happens to be, wherever you're listening, and we'll catch you on the next Physio Edge podcast. See ya.